सर ये लाइव सेशन होगा तो उसके रिगार्डिंग लाइव के लिए इसमें वॉइस क्वालिटी अच्छी आएगी इसमें।
Done? Yeah. Hand over. Written your name? Yeah. Done?
मैं तो यहाँ की हूँ सर।
तो क्या हुआ? Exempt. Then you should help me to collect these.
Okay.
हाँ ठीक है। Because anyway this we are going to find out how much we already know. Don't exert yourself much. Whatever we know. What is important is how much we have shifted from here to the end of the sessions. That would be important. So thank you. Please hand over the sheets to madam. Yeah, let us start the session. Before we start the session, one small formality. We are all strangers now to one another, except maybe some of you may know one another. So it would be better if we can just tell your name and which college you come from. Just two, because we don't have much time. We'll start with you, madam.
I'm Dr. Khushbu Prajapati, Associate Professor in Pharmacy, Ariana Homoeopathic Medical College.
Okay, same college. Okay.
Dr. Medini Joshi from Gandhinagar Homoeopathic Medical College.
Gandhinagar Homeopathic College. Yes.
Dr. Pankaj Bhatt, as a professor, J. Jalaram Homeopathic Medical College, Redhamabad.
Thank you, sir.
Gujarat.
Dr. Santosh Reddy, Parulishka Homeopathy and Research Center, Vadodara, Gujarat.
Gujarat. Parul. Okay.
I am Dr. Prachi Gupta, Associate Professor in Ananya College of Homeopathy.
Myself, Dr. Anupriya, Professor, Homeopathic Medical College, Sri Gangaraja, Tata University.
I'm Dr. Himali, Professor and HOD in Monarch Homeopathic Medical College in
Okay.
I am Dr. Sapna Maritra, Associate Professor, Monarch
I am Dr. Sunil Tiwari, Nutan Homeopathic Medical College, Visna, Associate Professor.
Okay.
Professor Dr. Rajnish Pathak from Lower University, Junagadh.
You can pass it to the next person.
Dr. Sachin Matre,
Myself, Dr. Pushpa Kumar, Associate Professor in the Department of Pharmacy, Sastri Homeopathic Medical College.
Professor James Homeopathic Hospital and College.
Dr. Shikha Sharma, Professor, SKRP, GHMC Medical College, Indore.
Professor Abhilasha Sundarani, Assistant Professor, CME Homeopathic Medical College,
Dr. Rohit Tiwari, Assistant Professor, RP Homeopathic Medical College.
I am Dr. Parthasarathy, Associate Professor and HOD in Department of Rural Pharmacy, RBS Medical College, Coimbatore, Tamil Nadu.
Medical College and Hospital.
Islampur, Jharkhand.
You have a few interactions. educational activities. Agree?
Yes.
I don't think anybody will disagree. So if this is the motto, we have two models of teaching and learning. One is what you can see here. You have the teacher feeding into the student, and you have a teacher or a facilitator trying to facilitate, direct the learner. Of these two models, which model would be appropriate for a learner-centric learning? First or second? Second. So second is more appropriate. And this is what the competency-based education intends to. It intends to empower the learner. So when you say it intends to empower the learner, when you are empowering somebody, there is always a fear that I am losing my power. When you empower somebody, that person becomes self-sufficient, you lose control over that. This is a fallacy. It's not like that. When you empower somebody, the way you build yourself to empower somebody will empower you more than the person whom you are empowering. Only then you can empower. So there is no fear that you will lose your control. There is no fear that you will lose your eminence. There is no fear that you will lose your prominence when you are empowering somebody. And the entire purpose of a teacher is to empower the student. Let's take one small example. I know we are running late and we will not be able to complete in that time. And when he, what is that you want? The person whom we are training should not be dependent. The same thing with the teacher. During the in a different manner, in a graded manner, dependent on the teacher, initially very dependent, and as the time passes, this is what is empowerment. And this is what happens in the competency based education. When you look at this as a person who is empowered or competent, the person who is learning, there are different pathways of learning. We would think that this is how everybody will learn, from point A to point B, and there is a straight line of whatever the learning. But to understand that each learner is unique and individual, competent is what your role as a teacher of your BHMS course. And when you look at this and map this, what is the length of this or this, it will not be 4.5 years. It may go to 6 years, it may go to 7 years. Does it mean that the person who is not in the framework of normal learner, or whatever we see, this is normal learning, you have to complete within this 4.5 years? Now what you do as a teacher, please note that you are not the only responsible person for the student to learn. The student is equal to learn, and this whatever happens here is the student's engagement into learning to comply with this competence. And this is, so what the teacher does is secondary, what the learner does is primary. So you had one question in the pre-test about the objective, so you can relate to that now. The second common thing that you can see in this is each of the statement starts with a verb, and that verb is an active verb, not a passive verb. Whether it is list, define, illustrate, or whatever, all these are active verbs which can be seen as performance, as against the passive verbs which could be something like know, understand, appreciate. So when you ask a student, do you understand, and the student says yes, I understand, what is the way that you know that the student has understood or not? There has to be some measure. Instead of that, if you say list something or demonstrate something or explain something, when the student gives an answer, that answer conforms to the normal or whatever is the actual response, you will know that this is a measurable performance. So these are the two things not fitting into the actual standard. You can flag that, you can bring it to the notice of the commission, and I'm sure they will take care of rectifying it, and they already have done some rectification till now. So this is what is the basic understanding, that when we talk of the objectives, the student objectives, it is what the student will perform, and how the student will perform is when you make it actual measurable, when you make it more objective. When this is an objective, it has to be objective. So by the other levels of homeopathic pharmacy, then you have the competency of identifying genuine drugs and sources. What are the genuine drugs? What are the sources of those drugs? Awareness of drug potency selection and administration. The knowledge of vehicle, dosage forms and dispensing of those medicines. Competency to interpret the doctrine of signature. And our curriculum is centered around these competencies. Is listed in our curriculum. These are a little later. Is defined as to bring about certain changes which are desirable in the behavior of learners on a relatively permanent basis. And now, how do these happen? Now, let us look at another factor. Imagine yourself, you are a teacher. No, you don't have to imagine. And in your classroom, where you see some students keep coming late, then you tell the students, no, you have to come in time. It cannot happen. My class is at 9 o'clock, so you have to come at 9 o'clock. If you don't come at 9 o'clock, I will close the door. So that is what you have told. After I will give you 1, I will not allow anybody who comes late. And some of them start coming in time, and some of them persist with whatever is their practice. Now, for them who have changed, who are coming in time now, who are not earlier coming in time, who are coming in time, how do you react to them? You say, see, that person has changed. What has changed? That person has changed. So why that person has changed? The person has learned, therefore that person has changed. We see that person's change in the behavior of coming in time and say this person has learned. And the person who is not coming in time, we say, see, this person has not learned. He has not learned because it is not seen in the change. So this is what is the purpose of education. In the purpose of education, you have to see change from point A to point B. If from point A the person is persisting in point A, there is no change, there is no learning. I will give you some example a little later. And how does this change happen? This change happens by way of acquiring knowledge. When a person acquires some knowledge, there is a change. I will give you one example. It may sound very, silly, but it's very. You also can relate to that. When I joined for the homeopathic course, and initially the anatomy teacher was talking something like superior, inferior. I thought I am superior. I got into this course, and some of my friends who were in the +2, they could not get into this course. They are inferior, right? Superior, inferior, my understanding. Now, as the teacher is talking more on what are the different terminologies used in anatomy, they are using other terms also and giving what is the meaning of this. So and when you are in that, you can see it comes. How does that? Whereas in but you hold so that they don't make any. This is what is education. Don't make any. This is what is education. So we expect the student to perform in the form of behavior. Learn to make it happen is by a. And how do you interconnected? So what is important here is the learning objectives, the teaching learning methods media, and the assessment methods. This is called as the spiral of education. That was one of the questions in your pre-test. Now when you are answering post-test, you know what the answer is. Okay. So now you can see here the objectives is influencing how the teaching is done. Let me take 2 examples. If the student has to list what are the sources of drugs, you can these are the sources of drugs, you expect the student to be able to recall them. Now imagine the student has to do the potentization. The student has to conduct succussion. If you give a lecture and eloquent to demonstrate, because this is how the nature of object appropriate, and whatever answer the student gives will you will know that okay, this student knows or does not know. On the other hand, if you ask a theory question, describe the procedure of succussion in a theory paper or in the viva, the student may answer it. Guarantee that the student can do it. And when you look at the CBDC assessment output would be, and the assessment output, the student attains this level, they go to the next level. So this is called as spiral. It is not circle. And when you implement the basic teaching model, to be able to perform. We said these are the objectives that we do the teaching. What you do? Definition of education. The definition of education. We are looking at that behavior here. It's not the good behavior, bad behavior. The behavior is what the student is able to perform in the form of knowledge, skill, or attitude. So, know, do, or feel. Cognitive, we will come to the cognitive, psychomotor, affective domain. After that, you do the teaching. After the teaching, you have the assessment. Now, this is the basic teaching model, and this is also a formula. Now, we have a situation where we see that some students are not performing well in a particular subject, or in a particular topic, or in a particular whatever. So, if you have to identify why it could be in the way the teaching was done. The teaching was done, maybe the objective was appropriate or valid, and how do we hook the student into this learning? And the first thing is to draw their attention, to attract their attention to your topic. Behavior, we do that. Festival is going on in the objectives were not told to them. We have studied. The fourth possibility is the assessment itself could be and this is the third tool which you have to understand, and this is something called as constructive alignment. The learning align. This is what is you have the expected outcomes. This is somewhat there is a possibility of that learning being aligned. Apparent is mapping onto the teaching. The three components expected. So these are the curriculum planning and basic tools. Curriculum planning and basic tools which are there in the curriculum, and you are know what happens. This one, simple words, 3 words are there. Your attention here for this. If you fail to plan, you plan to fail. So with this, planning is very important, and the tools that help us to succeed. One is the Bloom's taxonomy of education objectives. And if you recall the last 3 lines in the definition of education, we had the knowledge, skill, and attitude. Okay, a small bit of history here. There is an organization called American Psychological Association, APA, style of APA. So American Psychological Association is a very huge organization, one of the largest professional organizations. Long time it is there. In the 1950s, they had a convention, national convention, somewhere in the US, of course. So there, some of the teachers of psychology, they raised an issue about research is active, something which is active, something which affects the feelings, something to do with the feelings. The same can be deconstructed